Welcome to my channel. In this lecture we will discuss the cartilages of larynx. This lecture is very important. First we discuss the labels. The first label you can see is the epiglottis. This is above the glottis, it is the epiglottis. The second label is the hyoid bone. This is the bone that lie horizontally. The third label you can see is the thyroid membrane. The fourth one is the arytenoid cartilage. The fifth one you can see is the thyroid cartilage lamina. Sixth one is the vocal ligament. This is for the sound. And the seventh label you can see is the median cricothyroid ligament. And the eighth one is the cricoid ligament. And the ninth is the trachea. These are the structures that is present from the epiglottis to the trachea. These all are the structures, the cartilages that are present. Next we will discuss the anatomy. The cartilages of the larynx include the thyroid cartilage, cricoid cartilage, epiglottis, pale, arytenoid, corniculate and cuneiform cartilage. These all are the cartilages. This is in the cartilages of the larynx. Not shown in the illustration are the cuneiform cartilage is not shown. These paired elastic cartilage lie in the epiglottic fold and have no articulation, no joining with other cartilage or bones. Okay, the thyroid cartilage possesses the anterior place that is called laryngeal prominence, or we call it Adam's apple. The thyroid membrane has an opening through which the internal branch of superior laryngeal nerve enters the larynx. This nerve enters the larynx to provide sensory innervation about the vocal folds. Vocal cords, from vocal cords, the sound produced. These are vibrate and produce sound. Next, we will discuss the clinical. If there is any trauma to the cartilage of larynx, may result in a fracture. Consequently, the underlying laryngeal mucosa and submucosa may hemorrhage, resulting in the significant edema and the potential for airway obstruction. If there is any damage to the larynx have a vocal cords that produce sound, so there is a obstruction of airway. Ultimately, such an injury may result in hoarseness as the vocal folds swell and are compromised by the damage. Voice change, okay? Muscle or nerve damage. Due to muscle or nerve damage, making the speaking difficult or impossible. Larynx is a voice box. Okay, in this lecture we will discuss the cartilage of larynx, their anatomy and clinical. Thank you.